Hello, ladies and gentlemen, and welcome to Big Data and AI Toronto 2021. And today we're going to talk about a very important topic, which is cyberterrorism during and post COVID-19, how the global pandemic boosted cybercrime. Today, myself, Dr. Hisham Qaddoumi, I'm an AI and cybersecurity expert, specifically in the field of cyberterrorism and crime detection. I'll be joined by Dr. Raja Mishal, who is a family relationship and youth mental health consultant, to talk about this very important topic. Now, going back 2 decades or more, this was what an image that pops us to our mind when we talk about terrorism, international terrorism, people who look like this or live in places like that and have some feelings against the West, while in January 6th, 2021, we have seen another image of terrorism, domestic terrorism, which is what happened exactly at the Capitol Hill this year. Now, why is this happening? It's all coming back to bias profiling. Through decades and decades, the media have portrayed the classic image of terrorism. It looks like this guy, brown, bearded, carrying a Russian-made or cold weapon, wearing a kufiya, with an Arab or Muslim background, and hates the Western culture for no reason. By the way, this photo is just for a model, while this photo is for a real-life terrorist, real-life person who killed a lot of people. As you can see, he looks young, white, innocent face, and looks like just like the next door neighbor, or just a kid from the neighborhood. This photo is for Alexander Bisinet, a 27-year-old Quebec man who shot and killed 6 worshippers and injured 5 in a mosque attack in Quebec City in 2017. He have admitted that he was driven by extremist ideologies against immigrants and specifically against Muslim immigrants. We also know, we all probably have seen this guy, the New Zealand terrorist, which I'm not going to say the name, who also in March 15, 2019, have killed more than 51 worshipper and injured 40 in 2 attacks in mosques in New Zealand, in Christchurch city of or town, actually, in New Zealand. This was a targeted hate because he shot them deliberately. This was also a premeditated attack because we know that he was on multiple right-wing sites and hateful sites, including Gab.com, and he just published a hateful manifest, what he's going to do right before he does his crime. And it was also an online committed crime because he streamed this crime on Facebook for about 17 minutes. Now, the video was removed, of course, but it was too late. Millions have watched it. It was downloaded, and now it spreads through the dark web until this very day. The pandemic effect now, the rise of online hate, because that happened right before the pandemic in 2019. But with the pandemic, with all those lockdowns, we've seen like online sites like 8chan and the misinformation, it spreads or it spread through the internet. We also have seen movements like the QAnon and the rise of conspiracy theories among people and even politicians who were actually believing in and supporting QAnon. The high and fast recruitment in youth for extremist and terrorist organization and organized militias. Some of those militias we saw in like the Oath Keepers on January 6th, and the rise of white supremacy since the late 2016 and significantly during the COVID-19 pandemic. Now we have, why is that connected to the pandemic? We've seen all those anti-maskers around the streets, and we've noticed that most of those movement of anti-masking movement are actually related to racism. Like 6 out of 77 Canadian news reports on anti-masking topics explicitly detail the instances of racism. Examples of racism include like instances of anti-masker being particularly disrespectful toward immigrants and individual perceived as outsider, particularly those in Asian heritage. We've seen a lot of those people coming to Asian people and telling them go back to China, even though they were not Chinese or they were born in here, or they were just came from China to live here. That's all. That's all. Like doesn't. It's not a reason for them to tell them to go back to China, but it was in their heads because it was where the virus was originated. People are also closely associated the spread have associated actually the spread of COVID-19 with communism, and under the pretense of discrimination against individual from Asian background, We would calling it like the communist virus, the Chinese virus. We've seen also politicians who actually call this virus these names. And while there were an overwhelming focus of people who looked Asian, anti-mask sentiments were also directed to other individuals, including Black people, Indigenous people, and persons of color. Now, there was a study that's done in the UK about how the COVID-19 effect has caused, more empathy for radical and extremist ideology. And this study has shown us that there are a lot of factors that played into this leaning or empathy to extremism, like historical grievances and the role of authoritarianism, political climate, governance, socioeconomic factors. We know how the pandemic has a huge impact on social and economic factors as well. That the whole fall of economic systems during the COVID-19, marginalization of young people, international events funding the role of migrants, and radicalization in prisons are also intergroup or religious rivalries. Now, most of this information and all of these extremism happened online and through social media. So social media algorithms played a significant role in spreading misinformation for more engagement. Now, these algorithms, of course, they did not mean to spread misinformation, but they were made to push more engagement with people. And the more they did that, the more misinformation happened, because most of those algorithms keep funding content related to the user's history. Like if your history is leaning towards extremism, then those algorithms will give you more and more into your newsfeed of extremist content, which will create a silos of ideological silos for that, and will that create a little bit space of counter opinion balance that you will not hear or listen, which will actually raise anger and extremism. A study showed that misinformation spread 70 times faster than factual or actual facts and scientific views. Another study done, for example, on TikTok and anti-vaccine content, the study just included only 124 videos, which had like 20 million views, 1.6 million likes, 55,000 comments, and about 340 shares. And that's only 124 videos. Now, why is that important? Most of the people on TikTok are Generation Z and youth. And a US study showed that adults under 25 had the highest probability of believing false claims about COVID-19. And we know, if you want to connect the dots, COVID-19 misinformation and conspiracy theories are strongly connected to racism, hate, cyberterrorism. All of these effects have built that empathy towards radicalization, extreme ideologies, and by the result to violence and cyberterrorism. Now, to talk more about that, I want to invite Dr. Raja Mishal, who is he just talked about, who is the expert on this. So let's have a listen. Please join me welcoming Dr. Raja Mishal, who is the expert on this topic. Dr. Raja, welcome. And can you please tell us how the COVID-19 pandemic increased violence, or helped at least increasing violence and extremism, especially amongst the youth, from your own experience?
Thank you, Hisham. So today I want to focus on two aspects of the subject, and that is violence, but not as it relates to extremism, but related to domestic violence and mental illness, and how those two areas can really increase extremism. So, in the area of domestic violence, I'm going to just mention that there was an attack, like 6 attacks. And in those 6 attacks, that there were terrorist attacks, it was found that all the attackers were either abusers or witnessed abuse. So that tells us that domestic violence plays a role in having people as well being either recruited to be extremists, or they are the ones that are gonna go now, rather than abusing family members, to abuse strangers. And that's what happened in the attacks. So that's the first area. The first area I want to touch upon is the mental health. And as we know, mental health for youth is one of the ones that we know that youth aged 15 to 24 are more vulnerable to mental illnesses and substance disorder. They are even more vulnerable than, and they experience it more than any other age groups. And in this group, there is 75% of them that are not even able to find treatment services. So if you put those two together and you look at the age group that the extremists target, we are talking about an age group that has mental illness, right? And then if we look at it even before COVID, Statistics Canada in 2019, they published a study where in it they found that the majority of children and youth had already poor or fair mental health already before we got into COVID. So what happened during COVID? When COVID hit us, there were two things that were noticed globally even, and not just in Canada, and that is a surge in domestic violence and mental illness. And in Canada, we've done studies here. So I want to talk about one in Canada and one that was done overseas. And the first one that was published by the Sick Kids in Canada. And again, they found this year that the mental health of children and youth got more worse, like it was worsened by the online learning. And that happened during the initial COVID attack as well as during the second lockdown in March of this year. And what the study found as well, that there was a correlation between online learning and the symptoms of depression and anxiety. So that is what we found here this year. Last year as well, a study that was published, it talked about how the extremism or sympathies with extremism were correlated and associated with depression, symptoms of anxiety, and post-traumatic syndrome. So what we're looking at here is that we have mental illness that could be related to vulnerability to enhancing extremism.
Mhm.
If I want to put things into perspective, I want to just talk about, give you an example of a family. And this family has 6 members, the parents and 4 children. All children are aged between 13 and 25. So right off the bat, we can notice that the age is the right age for extremism, for mental illness. And in this case, the father is abusive and the children are diagnosed with diagnosed with mental illness. So we have both factors present in this case.
Mhm.
So this family is nothing but one example of many families that we have either in Canada or globally that are facing both risk factors, domestic violence as well as mental illness. So really what we need to do and look at very closely is that we need to first identify and treat mental illness as soon as we can. And the second thing is that we need to work on prevention and early intervention of domestic violence. Because as I showed today, the two factors can enhance vulnerability to extremism. So if we try to identify those factors and deal with them early on, then
Mhm.
that we would really accomplish something, and it would be the most effective way in reducing or even preventing extremism. Thank you, Hisham.
Thank you, Dr. Raja. So what we taken from is that with COVID hitting us and with all these mental illnesses that it's caused or it's exploited or amassed, let's say, because it was a massive thing. So that was one of the big reasons to for those youth to go extreme and probably be candidates for cyber terrorism. So thank you very much, Dr. Raja. Thank you for
Most
your
welcome.
help and experience. And we'll hope to have you again in other talks.
Thank you so much. You take care. Be blessed.
Thank you. Thanks again to Dr. Raja. And now I want to move to what can we do about that to solve this issue. And it's actually the best thing to do is a global approach by fighting the spread of toxic online content. And for that, we need to bring social media platform and big tech corporation on board. We also need to deal with mentally ill, specifically youth, with love and patience, because empathy and love, not fear and targeted profiling, is the real solution. We also need to keep open communication channel. It's the time that we have the best communication technology ever, so there's no excuse not to keep well and open communication channel. We also need global cooperation to detect extremism tendencies or tendencies to extremism, because it's a global problem that requires global solution and cooperation. It's not a country by country. Now, what do we expect if we did not do any of that? If we just kept things going on and we didn't do all of this, unfortunately, we expect a high rise of empathy with all types of extreme ideologies. We expect mental health issues might cause more violence, and by that we're talking about more extremism and more cyber terrorism. With also social and financial distress, will push more young people towards cyber terrorism. I just want to tell you that there was a recent a small study that showed that there are about 300 active hate groups only here in Canada. Now, mostly have presence either online by their own, they have all their own servers, or they have their own websites, or on social media platforms. Now, how can AI help with that? AI and the applied AI solution can help way more into that, and I've seen some solutions and some potential in those AI applications. There are AI solutions or applications that can detect mental problems through analyzing social media posts. So we can actually analyze the posts, and we can detect if the poster or the author of those posts have any kind of mental problem, so that we can solve them before they grow up. AI also can help. There's an AI solution that I've seen, I believe it was by IBM, that can help veteran with war battle mental trauma, those who came out from mental battles or mental fields with a war trauma. There was a chatbot that helps them to deal totally anonymously with their problems, and a lot of people of them showed more trust in machines than people because of the anonymity. There are also studies on how AI can create a predictive model for people with stress, trauma, and depression. And there are also many studies based on that and initiatives to eliminate AI biases and racial profiling in AI. We know that AI has a lot of problems when it comes to biases and racial profiling. That is also inherited by a human behavior and the human data that we put in. But the more we do those researches and the more we improve AI and machine learning, we learn that there might be better ways and better algorithms, the way that we design this algorithm and clean this data to create less and less bias, and to detect, probably even detect those biases and fix them forever. So thank you for listening. Thank you for being here. And the last thing that I want to say is awareness is the most important thing. You guys being here and listening to this is part of the solution. I hope you spread the word. I hope you tell people what you've learned today, and so we can actually detect that before happening. Because what we're doing right now is we fight terrorism, but I believe the real solution is to fight the roots that cause that terrorism. Thank you again, and now I will take your questions.